Hello, everybody. My name is Fernanda. I am one of the health education coordinators for High Sierra AHEC. Today, I want to talk to you guys about one of our K-12 pipeline programs, which is Project Prevent. Before we get started, I would like to introduce you to our workforce team. Whitney is our associate director. Amanda is our workforce planning manager. Mari is our programs and service coordinator and the person you would reach out to if you would like Project Prevent implemented at your school. Leilani and myself are the health education coordinators and the ones who will be implementing the program. And just a little introduction on High Sierra AHEC's workforce department. What we do, we create new informative and original content that introduces Title I and rural K-12 pipeline to healthcare career paths in order to address the healthcare shortages in Northern Nevada. So why Project Prevent? Project Prevent is an innovative outreach program targeting Title I schools specifically. It provides enriched content and comprehensive education. It focuses on health literacy, health policy, cultural diversity, interprofessional education, and current and emergent health issues and topics. Students are exposed to different healthcare careers. They learn how the healthcare system works. Also, they're able to understand and learn how to do appropriate research. And perhaps the most important part of it, they learn to advocate for themselves and their families. So how is this program implemented? Normally, it is an in-class program, and the program services coordinator, who is Mari, will connect with a teacher and they just work out the logistics of it, basically the time and the dates. It's usually about 5 sessions and they can range anywhere from 50 to 90 minutes. However, if a teacher can only give us 30 minutes, Leilani and myself can absolutely make that work. We will modify the modules. That way we can get our point across in 30 minutes. The difference between the 30 minutes and the 50 or 90-minute modules is basically the activities. A 30-minute session will be a little more lecture heavy. And our 50 and 90 minutes, we incorporate a lot of activities, hands-on. So our students are really engaged. So after that, if you guys are interested, go ahead and we can set up a date and just move forward. So this is a little bit on our modules. Our healthcare system module basically just talks about the different types of care out there, such as urgent care, primary care, specialty care, the types of hospitals there are, like nonprofit, private hospitals, so on and so forth. Our interprofessional education module is probably one of my favorites because it's literally like a case study all day. Students get divided into groups and each group gets a case study and they basically kind of role play. Some of them are the nurses, the doctors, and throughout the day they kind of get to work through the study case they get. The college preparedness one is pretty straightforward. We talk about college. But the really cool thing is that we have it as to where every year there's something you should be doing for you to be able to get there and accomplish your goals once you get out of high school and be able to move forward with college or higher education. Our research 101, it's very simple and it's very fun because we talk about what are the primary sources or secondary sources, what is their reliable source, and all this is because at the end of that module, we have a really fun debate with the kids, or health literacy and patient communication module. We basically just talk about the importance of patient and provider communication and how it needs to be clear. And for patients to know when they're signing paperwork, and be able to understand care instructions that they're given after certain appointments or procedures. Or public health module, what is public health, why is it important? We introduce them to certain careers in that particular field as well. So if you guys are interested in having Project Prevent at your school, please don't hesitate to contact Mari or Marissa, same person, who is our programs and services coordinator. She's wonderful. She'll be able to answer all of your questions and figure out logistics with you. So with all that being said, I just want to thank you and I hope to see you at your school.